Ladies and gentlemen, my name is Dr. Lee Sung. Welcome to my YouTube channel. Today, I want to speak about a topic that many men think about but rarely discuss openly: erectile health. Across the world, millions of men experience difficulties with erections at some point in their lives. Some struggle occasionally, while others face persistent problems that affect their confidence, relationships, and emotional well-being. In modern medicine, this condition is known as erectile dysfunction. Many men search for answers quietly. Some look for medical help, while others turn to the internet searching for simple natural remedies that promise fast results. One popular claim circulating online is the idea that drinking vinegar and olive oil together can quickly improve erections and keep them strong for hours. This idea spreads quickly because it sounds simple, natural, and easy to try at home. But to understand whether something like that could really work, we first need to understand how erections actually happen inside the body. An erection is not simply about desire. It is the result of a complex system involving the brain, hormones, nerves, muscles, and blood vessels. When a man becomes sexually stimulated, signals travel from the brain down the spinal cord and into the nerves of the penis. These signals trigger the release of chemical messengers that cause the smooth muscles inside the penile arteries to relax. Once those muscles relax, blood begins to flow rapidly into two sponge-like chambers inside the penis, known as the corpora cavernosa. As blood fills these chambers, the penis expands and becomes firm. At the same time, veins that normally allow blood to flow away from the penis are compressed. This traps the blood inside the erectile tissue and helps maintain the erection. This entire process depends heavily on healthy blood circulation. If blood flow is reduced, erections may become weaker or harder to maintain. That is why many of the conditions that affect the heart and blood vessels also affect erectile function. High blood pressure, obesity, smoking, and poor diet can damage arteries over time. The arteries in the penis are actually much smaller than those in the heart. Because they are smaller, they often show signs of circulation problems earlier. For this reason, doctors sometimes say that erectile problems can act as an early warning sign for cardiovascular disease. This brings us back to the idea of diet and natural health approaches. If blood circulation plays such an important role in erections, then it makes sense that the foods a person eats could influence sexual health. Among the many foods discussed in natural health circles, olive oil often receives special attention. Olive oil has been part of human diets for thousands of years, particularly in Mediterranean regions. Populations that traditionally follow Mediterranean eating patterns tend to experience lower rates of heart disease and better overall cardiovascular health. Olive oil contains monounsaturated fats, which are considered heart-healthy fats. These fats help improve cholesterol balance in the body. They can reduce levels of harmful LDL cholesterol while supporting healthier HDL cholesterol levels. Healthier cholesterol levels help keep arteries more flexible and less likely to become blocked. Flexible arteries allow blood to flow more easily throughout the body. Olive oil also contains powerful antioxidants known as polyphenols. These compounds help protect the lining of blood vessels from inflammation and oxidative stress. Healthy blood vessels are essential for strong circulation, and strong circulation is essential for erections. For that reason, many doctors encourage people to replace unhealthy fats with olive oil as part of a balanced diet. However, it is important to understand that olive oil is not a fast-acting erection booster. It does not instantly increase blood flow the way certain medications do. Instead, it supports long-term cardiovascular health when consumed regularly as part of a healthy diet. Now let's consider vinegar. Vinegar, particularly apple cider vinegar, has been discussed widely in health communities. Some studies suggest that vinegar may help regulate blood sugar levels when consumed in small amounts with meals. Blood sugar control is extremely important for men's health because type 2 diabetes is one of the leading causes of erectile problems. High blood sugar over long periods can damage nerves and blood vessels throughout the body. When blood vessels are damaged, the flow of blood to the penis can become restricted. When nerves are damaged, the signals that trigger erections may not travel properly. If vinegar helps improve insulin sensitivity or reduce blood sugar spikes in certain individuals, it might indirectly support long-term vascular health. But again, vinegar itself is not a direct erection-producing substance. It does not trigger an erection immediately after drinking it. The idea that mixing vinegar and olive oil together can instantly produce a powerful erection is largely a myth created by oversimplified health advice and exaggerated claims online. Many people want a simple solution. A quick drink that solves a frustrating problem sounds appealing, but the human body rarely works that way. True improvements in erectile function usually happen gradually through consistent lifestyle changes. Regular exercise helps improve circulation throughout the body. When the heart becomes stronger and more efficient, it pumps blood more effectively through the arteries. Maintaining a healthy weight also plays a major role. Excess body fat is linked to inflammation, reduced testosterone levels, and poor vascular health. Stress management is another important factor. Chronic stress increases levels of cortisol, a hormone that can interfere with sexual function and reduce libido. Sleep is equally important. Poor sleep patterns can disrupt hormone production, including testosterone, which is essential for male sexual health. Alcohol consumption and smoking can also damage blood vessels. Smoking in particular narrows arteries and reduces oxygen delivery to tissues, which directly harms erectile function. Because so many factors influence erections, focusing on a single food or drink rarely produces dramatic changes. That is why medical treatments were developed to target the specific biological pathways involved in erections. Two of the most commonly prescribed medications for erectile dysfunction are sildenafil and tadalafil. These medications work by enhancing the effect of nitric oxide, a natural chemical released during sexual stimulation. Nitric oxide relaxes the muscles surrounding blood vessels in the penis, allowing them to widen. When those vessels widen, blood can flow into the erectile tissues more easily. This increased blood flow helps produce and maintain an erection during sexual activity. Unlike natural home remedies that rely on general health improvements, these medications act directly on the mechanisms responsible for erections. However, even these medications are not magic pills. They still require sexual stimulation to work, and they should only be used under the guidance of a qualified healthcare professional. Returning to the discussion of natural habits, it is important to look at the bigger picture of men's health. A balanced diet that includes vegetables, fruits, whole grains, lean proteins, nuts, and healthy fats such as olive oil can support cardiovascular health. Better cardiovascular health leads to better circulation, and better circulation supports stronger erectile function over time. But the improvement does not come from one specific drink or one specific ingredient. It comes from the overall pattern of healthy living practiced consistently day after day. Another important aspect of erectile health is psychological well-being. Many men experience performance anxiety. Worrying about whether an erection will occur can actually make it more difficult for the body to respond naturally. Stress activates the body's fight-or-flight response, which redirects blood flow away from non-essential functions, including sexual arousal. Relaxation, communication with partners, and emotional connection can help reduce this pressure. When the mind is calm and the body is healthy, sexual responses often improve naturally. Doctors often remind patients that erectile health reflects overall health. If the heart, blood vessels, nerves, hormones, and mental state are functioning well, the body usually responds appropriately during sexual stimulation. When erections become consistently difficult to achieve or maintain, it may be a sign that something deeper is happening within the body. In many cases, addressing the underlying cause, whether it is cardiovascular disease, metabolic imbalance, hormonal deficiency, or psychological stress, can restore sexual function. That is why medical professionals encourage men not to ignore persistent erectile problems. Instead of relying on viral internet remedies, it is wiser to speak with a healthcare provider who can evaluate the full picture of health. Simple lifestyle improvements combined with proper medical guidance can often produce significant improvements. So when people ask whether drinking vinegar and olive oil can create powerful erections for hours, the honest answer is that these ingredients alone are unlikely to produce such dramatic results. However, when incorporated into a balanced diet that supports heart health, they may contribute to better overall circulation over time. And better circulation is one of the foundations of healthy erectile function. Understanding this bigger picture allows men to focus on long-term health rather than short-term promises. Because true sexual vitality is not built in a single moment or through a single drink. It is built through daily habits that support the entire body. As we continue this discussion about erectile health, it is important to explore the deeper factors that influence a man's ability to achieve and maintain a strong erection. Many people search for quick solutions, hoping that a single drink, herb, or supplement will instantly solve the problem. But the truth is that the human body works through systems that are connected. Sexual health depends on the health of the heart, blood vessels, hormones, nerves, and even the mind. When any of these systems becomes imbalanced, erectile function can suffer. This is why doctors view erectile dysfunction not simply as a sexual issue, but often as a sign of broader health conditions. One of the most important factors in erectile performance is blood vessel health. Arteries must expand properly to allow blood to flow quickly into the penis during arousal. If those arteries become stiff or narrow, the amount of blood entering the erectile tissue becomes limited. When that happens, erections may become weaker or shorter in duration. Over time, poor lifestyle habits can damage the lining of blood vessels. High levels of bad cholesterol, chronic inflammation, and high blood pressure can slowly cause plaque buildup inside arteries. When plaque accumulates, arteries become narrower and less flexible. The arteries supplying blood to the penis are extremely small compared with the arteries of the heart. Because they are smaller, they may show symptoms of circulation problems earlier. In some men, erectile problems appear several years before heart disease is diagnosed. For this reason, many cardiologists consider erectile problems to be an early signal that vascular health should be evaluated. Physical activity plays a powerful role in improving circulation. When a person exercises regularly, the heart becomes stronger and pumps blood more efficiently throughout the body. Exercise also improves the elasticity of blood vessels, allowing them to expand more easily when blood flow increases. Walking, swimming, cycling, and resistance training can all contribute to better cardiovascular function. Even moderate activity practiced consistently can produce meaningful improvements in blood flow over time. Exercise also helps regulate body weight. Excess body fat is associated with increased inflammation, insulin resistance, and lower testosterone levels. All of these factors can negatively affect sexual health. Hormones also play an important role in erectile function. Testosterone, the primary male sex hormone, influences libido, energy levels, muscle mass, and sexual response. When testosterone levels fall significantly, men may notice reduced sexual desire and weaker erections. However, it is important to understand that low testosterone is only one possible factor. Many men with normal testosterone levels still experience erectile problems due to circulation issues or psychological stress. Balanced nutrition supports hormone production as well as vascular health. Diets rich in vegetables, fruits, legumes, whole grains, fish, nuts, and healthy fats help provide the nutrients the body needs to maintain healthy cells and blood vessels. Among these healthy fats, olive oil is often highlighted because of its beneficial fatty acid profile and antioxidant content. Regular consumption as part of a balanced diet may help support healthier cholesterol levels and protect blood vessels from damage. Vinegar has also gained attention for its possible influence on metabolism. Some research suggests it may help moderate blood sugar levels after meals in certain individuals. Maintaining stable blood sugar is important because type 2 diabetes is one of the most common medical conditions linked to erectile difficulties. Over time, high blood sugar can damage both nerves and blood vessels. When nerves become damaged, the signals that trigger erections may not travel effectively from the brain to the penis. When blood vessels become damaged, the flow of blood needed for an erection may become insufficient. Preventing or controlling diabetes through healthy lifestyle habits can significantly reduce the risk of erectile problems. Sleep is another factor that often receives less attention than it deserves. During deep sleep, the body performs many important repair processes. Hormone production is regulated, tissues recover from daily stress, and the nervous system resets. Men who consistently sleep too little may experience reduced testosterone levels, fatigue, mood changes, and decreased sexual desire. Over time, poor sleep habits can affect overall health and sexual performance. Stress also influences sexual function. When the brain perceives stress, it releases hormones such as cortisol and adrenaline. These hormones prepare the body for action, but can interfere with relaxation and blood flow necessary for sexual arousal. If stress becomes chronic, the body may remain in a constant state of tension. This tension can disrupt hormonal balance, sleep quality, and emotional well-being. Psychological factors can play a major role in erectile function. Anxiety about performance can create a cycle in which fear of failure actually increases the likelihood of difficulty during sexual activity. Open communication with partners, relaxation techniques, and sometimes professional counseling can help break this cycle and restore confidence. Another lifestyle factor that strongly influences erectile health is smoking. Tobacco smoke contains chemicals that damage the inner lining of blood vessels and reduce nitric oxide production. Nitric oxide is a critical molecule that allows blood vessels to relax and widen during an erection. When nitric oxide availability decreases, the ability of arteries to expand becomes limited. This can make erections more difficult to achieve and maintain. Alcohol consumption also plays a role. Small amounts of alcohol may temporarily relax inhibitions, but excessive drinking can impair nerve signals and reduce testosterone levels. Chronic heavy alcohol use can lead to long-term damage to the nervous system and liver, both of which affect sexual health. Because erectile function depends on many interconnected systems, effective treatment often involves addressing multiple aspects of health simultaneously. For men who require medical treatment, doctors frequently prescribe medications that enhance blood flow to the penis during sexual stimulation. Two widely known examples are sildenafil and tadalafil. These medications belong to a group called phosphodiesterase type 5 inhibitors. They work by preserving the effect of nitric oxide, allowing blood vessels in the penis to remain relaxed for a longer period during sexual stimulation. As a result, blood can fill the erectile tissues more effectively, helping produce a firm erection. It is important to remember that these medications do not create sexual desire on their own. They simply support the body's natural response to stimulation. A healthcare professional must evaluate whether these medications are safe for an individual, particularly if a person has heart conditions or takes certain other medications. While medical treatments can be effective, many doctors encourage men to view erectile health as part of overall wellness rather than focusing solely on short-term performance. Healthy eating patterns, regular physical activity, adequate sleep, stress management, and avoidance of harmful substances create an environment in which the body can function at its best. When these foundations are strong, the systems responsible for sexual response are more likely to operate smoothly. Returning to the idea of vinegar and olive oil, it is reasonable to include these ingredients in a balanced diet if they are consumed in moderation. Olive oil can serve as a healthier alternative to certain saturated fats, and vinegar may add flavor to foods while potentially supporting metabolic balance. However, expecting dramatic, immediate results from a simple mixture of these ingredients is unrealistic. The body's processes are gradual and interconnected. Improving circulation, balancing hormones, strengthening the heart, and reducing inflammation require consistent healthy habits practiced over months and years. When men understand this broader perspective, they are less likely to fall for exaggerated claims and more likely to focus on meaningful lifestyle improvements. Sexual health is not isolated from the rest of the body. It reflects the condition of the cardiovascular system, the balance of hormones, the health of the nervous system, and the state of the mind. By nurturing all of these areas, men can support both their overall health and their sexual vitality. In the end, the most powerful approach is not a miracle drink or a viral remedy. It is a combination of knowledge, healthy choices, medical guidance when necessary, and patience as the body responds to positive change. When these elements come together, many men find that their confidence, energy, and sexual health improve naturally over time.